We will get started. And so thank you, welcome everyone. And a huge thank you to everybody for being here with us. I'm Anita, and we're excited that our February event is our first ever Doc Talk. And who better to help us with that than our very own Dr. Riz. Having him here today with us is special, not only because he's a vascular surgeon. February is Heart Health Month. I know we put that on the flyer that we had out, but also special because both Dr. Riz and Maya have been our mentors and very instrumental in our ability to start and run Green and Fit Frisco. So a special thank you for that as well. A very short introduction. Dr. Riz is a vascular surgeon. I'm sure most of you know. He's been practicing for over 20 years in Dallas. He's also lifestyle medicine certified. And Maya, Dr. Riz's wife, and he run Plant-Based Dallas Port DFW as a means to educate and support our community on healthy lifestyle choices. So again, can't say enough. We're so excited and grateful to have both of you here with us and your presence and your guidance for us today and always.
Just some housekeeping notes for all of us. Please stay in mute. If you have any questions, please send it to us via chat. We will have some time at the end of our session to answer those questions. And if we run out of time, just send your questions on our events page or send them our way, and we'll make sure that they are answered for you. Without any ado, Dr. Riz.
Okay, thank you. So I want to start by giving a little talk on cardiovascular disease and nutrition, and I've shortened it a little bit because Maya tells me my talks always take too long. So I'm going to move through this pretty quickly, and so I hope I don't move too fast, but I want to leave some time for discussion afterwards so people can ask questions. I don't want it just me be talking and then say goodbye, everybody. So I'm going to start sharing my screen and then bring up my slide set. All right, well, I want to thank Fit and Green Frisco for inviting me today. Of course, we found some time to give this talk for our good friends, and I'm honored to be asked to give you a talk. So I'm going to talk about what my specialty is. This is what I do every day, and I'm a specialist in cardiovascular disease. Specifically, I'm a vascular surgeon. And there's different doctors who treat cardiovascular disease, and depending on the parts of the body, but also as it relates to nutrition, because in the last few years of my life, I've become especially concerned or interested in how nutrition impacts our health. And what I've learned is nutrition is really at the core of our overall health. And once you start to learn that and you can apply nutrition to your health, you can change your life. So without further ado, so I'm Dr. Riz. My practice is North Texas Vascular Center. I have a clinic in the East Dallas Mesquite area. And again, specifically, I treat atherosclerosis and cardiovascular disease. This disease is a very devastating disease. It affects 40 to 50% of Americans in varying degrees. It is responsible for significant morbidity and mortality, illness and death in over 1 million Americans every year. And that's just the ones who get significant morbidity and death. There are millions others who are affected to a lesser extent who are then progressing on towards the end of life stuff that I treat later on in their lives. So there are different doctors who treat this disease, atherosclerosis. So there's the cardiologist and the cardiac surgeon. They treat atherosclerosis of the heart. And then I, as a vascular surgeon, treat atherosclerosis everywhere else in the body. And atherosclerosis is basically hardening. Heart disease is atherosclerosis. It's hardening of the arteries. It's where people build up plaque on the inside of their arteries, which then causes narrowing and blockages and affects the blood flow to different aspects of the body. I'm actually going to take a little step back and speak just a second as to why is a vascular surgeon talking to you about this. And it's a little bit odd because you don't see too many vascular surgeons talking about this. In fact, I'm the only one I know in the entire country who speaks on cardiovascular disease and nutrition, and especially promoting a plant-based lifestyle. And I got into this in two ways. There's both a professional pathway and a personal pathway. Personally, I'd always been interested in my own health, and I've exercised. I did what I thought was eating right, And despite, being lean and I could run six to 10 miles, I used to do half marathons and 10Ks all the time. And I ate what I was considered a low-fat, but really a high-protein, animal-based diet. Towards my mid to late 40s, I actually was pre-hypertensive, pre-diabetic. My cholesterol was high, and it was 227, and my triglycerides were high. And so, despite what I thought was living an extremely healthy lifestyle, I started to realize that I'm really heading down the same path as most Americans, that by the time I'm 50, I'm going to be on some medications for chronic diseases. For me, which would have been hypercholesterolemia, hypertriglyceridemia, hypertension, and probably diabetes. And in my search for more knowledge, and with the help of my wife Maya, I went to see somebody called Rip Esselstyn at a Whole Foods, who gave a talk that challenged my current belief set. He actually said you could prevent and reverse heart disease. And that's something that, as a vascular surgeon, a specialist in this disease of atherosclerosis, that I had never been taught. And I came out of that talk a little bit skeptical, but at the same time, it had challenged me enough that I wanted to learn more. And I did go on to investigate and learn more. And up here, I put on the screen 2 books that I went on to read. One was The China Study by T. Colin Campbell, and the other was How to Prevent and Reverse Heart Disease by Caldwell Esselstyn. And these things really opened my mind to a new world. And really, it's quite a simple thing, really, that what we put in our bodies affects the disease processes that occur. And if we're very careful and learn to eat in a different way that we're taught from the very beginning, we can actually not develop these diseases. And then, interestingly enough, we can also slow down the progression, or even in some cases reverse the progression of atherosclerosis. And interestingly enough, this doesn't just apply to atherosclerosis, but this applies to the majority of the chronic diseases that we face in the United States today. Professionally, after decades of being a vascular surgeon, I began to get a little bit frustrated because my patients were what I call repeat offenders. I would fix something and they would come back. And I was just kind of plugging holes and putting out fires, but I wasn't curing their process or curing their disease. And these patients of mine were spending the last decades of their lives, really 10, 15 years of their lives, in misery. They were having multiple operations, in and out of the hospital. They were spending all of their retirement money. So at a point in our lives as a society where we hope to retire and enjoy our lives, these patients were living a miserable existence. And so I was particularly frustrated by that. Around this time is when my professional and personal paths merged, and the stuff that I had learned about the China Study and how to prevent and reverse heart disease allowed me to apply those same concepts to my patients. And I started to incorporate lifestyle changes, especially nutrition, but as I learned more and more, other things as well, such as sleep and avoidance of risky behaviors and getting exercise and a few other things. And so I started applying these to my practice as far as how I counsel my patients on how to live. So that's the quick story on how a vascular surgeon got to this point as being thinking how important nutrition and lifestyle is. Here's some diagrams to kind of demonstrate what these do to the arteries. On the left side of the screen, these are some longitudinal sections of the leg arteries. On the far left is a normal appearing artery where the opening is unimpeded, there's no problems, and there's normal blood flow. Just to the right of that is the depiction of how plaque might build up and narrow the lumen, or the opening of the artery. On the far right of the picture is another depiction of how atherosclerosis might progress throughout one's life. The first picture is what we call fatty streaks. Those are just little yellow areas that form underneath the surface, and they don't really impair blood flow, but they are the beginnings of atherosclerosis. The middle picture is a nice picture of a fairly advanced case where people are going to begin to exhibit symptoms. The blood flow is markedly impaired. And then the picture on the far right is a picture of advanced atherosclerosis. And the ones that I treat are those 2 pictures on the right. And what I'd hope to do is I hope to get to people when they're not there, and maybe on the picture on the left, and maybe help them change their lives so that they don't develop into that stuff on the right side. An interesting story about this fatty streaks, the ones where it's just the small beginnings of atherosclerosis. Atherosclerosis is a slow, indolent disease that grows over decades, but it accelerates later on in life. And we've learned that atherosclerosis actually begins early in life. One of the first studies to show this was a study on Korean war vets back in the 1950s, where they did autopsies on, I think it was 300 consecutive Korean vets that had been killed in action. The average age of these young men was 22 years old, and interestingly enough, 78% of them had the beginnings of atherosclerosis. They had fatty streaks. So what we learned from that is that atherosclerosis was already present in 80% of people by the time they were 22 years old. And then now I'd fast forward to our current times. That was in the 1950s. Here we are now, 70 years later. And I would propose that atherosclerosis is now progressing at a faster rate. When I first started my practice in the 1990s, the average age of my patients was 65 to 70 years old. Now, the average age of my patients is in their late 50s and early 60s. So this disease is presenting at an earlier age. And my theory behind that is that over the course of the last 70 years, our diet has gotten much, much worse. We've now entered this fast food era where McDonald's, which didn't exist in the 1950s, is present everywhere. There's fast food everywhere, processed foods are everywhere, and we eat a very unhealthy diet from the day we're born. We're kind of programmed that way, not understanding that that's having such a profound impact on our health. I'd like to mention that something called nitric oxide, because I'm going to talk about this a little bit more. Nitric oxide is my favorite molecule in the body. It's secreted by endothelium of the arteries. The endothelium is a single cell layer, thick layer of lining, which is on the inside of the artery. And the endothelium is extremely important to the overall health of the artery. The artery also has a middle layer, which is a muscle layer, and an outer layer, which is called the adventitia. So most arteries are 3 or 4 layers thick. And arteries are living, breathing organs. They are not static pipes like PVC. They are contracting, they are dilating, and they are constantly allowing things to go out through them, and they're secreting things as well. So they're a very active part of our circulatory system. So on the left side of this picture is a true histologic slide of a normal artery. You can see those those layers I was talking about. On the very inside is a very small kind of purplish red layer that's only 1 cell layer thick. Then the thicker layer is what we call a muscular layer, and then outside of that is the adventitia. That's a normal, healthy appearing artery. On the right side of the picture is a markedly diseased artery. And you can you just look at that and you can tell that is not normal and that is not healthy looking. The opening of the artery, of course, is very small. Outside of that, then if you look at the inner layer, there is no endothelium, so there is no nitric oxide being produced. And then there's a very thick layer, and that thick layer is atherosclerosis. That's fibrosis, that's scar tissue, that's the buildup of plaque, which is cholesterol and saturated fat and calcium. And it's also inflammatory. It's full of an inflammatory process. So that's a very unhealthy artery. So I had talked about nitric oxide. Why is nitric oxide so important? Well, it's a very powerful vasodilator. It helps our arteries dilate. And when our arteries dilate, it, number one, helps deliver more blood flow to the region where we want it. And number two, it decreases our blood pressure, which is a good thing. And also, nitric oxide is very important in preventing atherosclerosis. So it's very essential for arterial health. So if you think about it, when people develop atherosclerosis, it destroys the endothelium, and therefore they can no longer make nitric oxide. So it's a kind of a self-feeding or perpetuating process. You destroy your endothelium, you release less nitric oxide, and therefore it makes you more prone to the development of atherosclerosis. So arterial health is extremely important in preventing atherosclerosis. So what are some of the complications from having atherosclerosis? Well, one of the ones everyone knows about is a heart attack. So basically, whatever artery is affected, whatever that artery is supplying, whatever's downstream of that artery is going to have effects. So if your heart arteries, or they're known as coronary arteries, are affected, then you're prone to having heart attacks. If the arteries going to your brain, which the carotid arteries here in the neck, are affected, you're especially prone to stroke. And interesting enough, most people don't realize this, but dementia is also a vascular issue. We talk about Alzheimer's dementia all the time, and so it gets a lot of press. And most people must think that Alzheimer's dementia is kind of the main dementia. But the reality is there's probably more vascular dementia that's out there than Alzheimer's dementia. So dementia from a vascular standpoint occurs when the very small microscopic blood vessels in the brain get blocked off. And they might cause what we call a microinfarct, a very microscopic area of death. That in and of itself might not even create any clinical circumstances or findings. But when you have thousands of these over the course of a few years or a couple of decades, then these areas of infarcts or death of the brain coalesce, and they begin to have a major impact on the function of the brain and can lead to dementia. So vascular dementia is a very real and serious problem. So I put this up and for shock value. This is what happens when the arteries of the leg get blocked. People develop gangrene, and this is one of the main things that I treat. I'm a limb salvage specialist, and amputation prevention is one of the things that I try to do. I'll get that off the screen for you. If we're unsuccessful in saving the limb, then people get amputations. And I would say a good 10% of the patients that present to me at some point in their lifetime are going to lose their limbs. We fight very hard to maintain the blood flow and to save their limbs and try to keep their limbs on for the rest of their lives. But the honest reality is that we're not successful at least 10% of the time. Interestingly enough, most people don't realize that impotence is really a vascular problem. The blood flow to the pelvis is important. And if you have no blood flow into the pelvis, then impotence results. It's a serious problem. 40% of men in their 40s experience some form of impotence. 50% in their 50s and 60% by the time you're 60 will experience some form of impotence. Not permanent, but some form of it. And I always tell people that this is a harbinger or a warning sign. If you are in your 40s and you're experiencing significant impotence issues, then that might be a sign that you have atherosclerosis or cardiovascular disease. And it's certainly something that bears investigating. And so, we talk about these medications like Cialis and Viagra that help with impotence. And what they are is very powerful vasodilators that improve the blood flow to the pelvis. And so they cause the arteries to dilate and cure the impotence for a very short period of time. And so they are dilating blood vessels just so that you get a very short effect. So not only does atherosclerosis lead to these chronic debilitating issues that I pointed out, but the ultimate problem is death. My patients, when they present, they have very advanced medical problems. They all have diabetes and hypertension. A good deal of them have some form of heart failure. Renal failure. They all have high cholesterols, high saturated fat. And so they got multiple chronic diseases going on, and then these diseases contribute to atherosclerosis. The sad fact is there's a very high death rate in my patient population. I would say that nearly 50% of my patients are dead between 5 and 10 years after I've met them. And that's not because I'm a bad vascular surgeon and can't treat them, but it's because the other diseases that they have, they succumb to one of these chronic diseases over time. So what causes atherosclerosis? Well, atherosclerosis is a lifestyle-related disease. It's a chronic disease that occurs because of how we treat ourselves over the course of our lifetime. And the major issues that affect that are diet and smoking. And I'd like to take a second, people don't really understand how important diet is, and they all think that maybe it's genetic or maybe it's my smoking. Let me address smoking for a second. Now, I won't deny that smoking is a significant component of some atherosclerosis, but since 1964, when the Surgeon General put a warning label on cigarettes, the smoking of incidence has decreased every single year from 1964 to the present. We now have less people smoking in the United States than we've ever had in our history. Yet, over the last 40 to 50 years, the incidence of atherosclerosis has tripled. So smoking in and of itself is not the main factor. If smoking was the primary issue, we would have seen a decrease in incidence of atherosclerosis as well. So there's something else going on. And in my opinion, and in the opinion of many experts, that's our diet. It's our nutrition. So what about our diet? So it's specifically, there are things in our diet such as cholesterol and saturated fat that are in the standard American diet, and processed foods. We put a lot of foods in our body that are not natural. The standard American diet is generally inflammatory. It's an acidotic diet that causes inflammation in our body. Very specifically, I wanted to mention genetics. A lot of people think that, okay, my mom had a stroke or my dad had a heart attack, so I'm doomed to have the same thing. And that's not true. While we may have similar genetics, it's how the environment has a much more significant impact on what happens to us over time. And we've learned that from things like twin studies. If you take twins who were separated at birth and you then look and see what caused their demise at the end of life, well, if genetics is what determined their entire outcome, well, they would both die at the same age and of the same disease. And that's not the reality. In twin studies, you see that twins die of very different diseases and at very different times. Some will live much longer than the other, and they die of different causes. And that's because what's really more important is the environment that they were raised in. And that environment, the primary aspect of that environment is what we put in our bodies, and that's our food. In more detail, what's happening at the microscopic level is that there's direct injury to the endothelium of the artery, that endothelium I talked about, that one cell layer that lines the inside of the artery. And that direct injury is caused by saturated fat and cholesterol, and maybe the toxins from smoking. And then what we get is inflammation there. And that is a hyperimmune response at a microscopic level. And what do I mean by a hyperimmune response? Well, if you get a splinter or a bug bite, let's use a bug bite. If you get a bug bite on your hand or your arm, you're going to get a little red swelling, you're going to get some pain, it's going to be surrounded by some redness. That's an immune response. And we're supposed to have that response because we're defending ourselves against the toxins of that bug bite. And then after a while, after it's occurred, it calms down and it goes away. Unfortunately, at the microscopic level in the blood vessels, the immune response is a hyperimmune response. It's over-exaggerated and more than it should be. And what happens is we recruit all of these these cells and hormones that cause an inflammation that is ongoing. And as we continue to eat saturated fat and as we continue to eat cholesterol, we continue this process, this immune response. And what happens is fibrosis occurs, the buildup of calcium occurs, the deposition of cholesterol and saturated fat occurs, and you have plaque buildup. And then that blocks the artery. So there are, and that's the direct injury aspect of it. Then there are the other chronic diseases that contribute highly to atherosclerosis, such as obesity, diabetes, and hypertension. Diabetes doubles the inflammatory response at the microscopic level. Obesity leads to diabetes as well. Hypertension directly injures the blood vessels. So there's the other chronic diseases that we develop as a result of our current diet, then also injure our arteries and lead to more atherosclerosis. So the standard treatments that we have are drugs and surgeries. We throw lifelong medications at these things. We treat cholesterol with medications. We treat diabetes with medications. I do procedures on people to do bypasses and stents and clean out the arteries. And these are not cures. These are things that we do after the disease occurs to just temporize and to control the disease, but we don't cure the disease. Okay, and that's a really strong point I'm trying to make. You still have the disease if I'm giving you a pill for it. We're just trying to control the symptoms of it. And if I do a bypass, you still have the disease. I'm just trying to fix a certain area. And unfortunately, this method we're not winning the battle with this method. Disease numbers and treatment costs are skyrocketing. The cost of medicine in the United States is going out of control. Within the next 10 years, we won't be able to afford to care for everybody. So again, these are stopgap measures, and it does not address the root cause of the disease, which is our lifestyle choices. So is there a better way? And obviously I've been getting to this point. There is a better way to prevent, and that's what I'd like to really emphasize, and to treat, because I don't want people to get the disease. To treat it is, it's harder to treat and harder to make it go away than it is to prevent it in the first place. There's a couple of studies that I'll point out. One of my heroes, Dr. Dean Ornish, did a study back in the late 80s, and it was called the Lifestyle Heart Trial. He took people with coronary artery disease, and he split them into two groups. And this was angiographic. In other words, they had done catheterizations where they had pictures and proved the disease. And he split them into two groups, a treatment group and the control group. The control group was getting what we called best medical therapy at the time. They were told to change their lifestyles, and they were told to eat right. They were told to quit smoking. And then they were sent home and monitored in a normal way. The treatment group underwent intensive lifestyle changes, and that means that they were really put through cardiac rehab. They were taught to eat differently. They were taught to get better sleep. They were taught to meditate. They were taught to quit smoking. And this was done through, I think, an intensive 12-week program. And what they saw is here on the screen is that the treatment group actually got better. They did follow-up angiography on these, and in the treatment group, the blockages got less. And in the control group, guess what? Well, standard American diet, what always happens is they get worse. And not only that, the standard American diet group, they had more heart attacks, they had more deaths, they had more need for catheterizations, they had more need for heart bypasses. The treatment group, they had less bypasses, they had less heart attacks, and so clearly there was a difference based on lifestyle treatment. And this work went on to be published in The Lancet, which is one of the most prestigious journals in the world. And Dean Ornish was in the 90s considered to be one of the 100 most influential Americans. Another study, and I've mentioned Dr. Caldwell Esselstyn. This is just an example here. On the left is the picture of a patient with blockages in his artery. You can kind of see it's very clear that that artery is narrowed. And then after 2.5 years of intensive lifestyle changes, you can see the picture on the right where there is no more disease in that same artery. Interestingly enough, this was a colleague of Dr. Esselstyn's at the Cleveland Clinic, and he had been told by the cardiologist there at the Cleveland Clinic that he was going to have a stent or a bypass. And he said, wait a minute, no. And he had not been a believer in Dr. Esselstyn's work, but then he went to Dr. Esselstyn, and Dr. Esselstyn put him on this intensive lifestyle changes, and in 2.5 years, his disease had been reversed. So he didn't need to have his chest split open to have a bypass operation. So what are the changes? Basically, this diet is based on whole plant-based foods. It's eating foods in their closest to their natural state as possible, no processed foods. This includes vegetables, fruits, whole grains, and legumes. Those are really the 4 main food groups. I'm especially fond of the green leafy vegetables because these green leafy vegetables are very high in nitric oxide content. Kale, Swiss chard, spinach, arugula, beet greens, romaine, greens of all sorts. My favorite is arugula, especially baby arugula, because it has the highest nitric oxide producing content of all of them. But I encourage people to get a variety. I personally try to get several servings of green leafy vegetables a day. So starches such as potatoes, rice, and whole grains, and pastas, nuts and seeds in reasonable amounts because these are actually high in fat. Healthy fat, but high in fat, so you don't want to overdo it. I tell people to limit to 1 to 2 ounces a day, and minimized to no processed foods. So what foods are not included? Meat, yes, fish is a meat also, so no fish. It does not include dairy, such as milk and cheese. It doesn't include eggs. Meat and fish are high in cholesterol and saturated fat. Dairy is very high in saturated fat. Eggs are high in cholesterol. It doesn't include highly processed foods and oils. I want to talk about oils for just a second here. Oils have no nutritional value whatsoever. Absolutely none. Oil is pure fat. Okay, all an oil is the fat expressed from something, and you've taken away all of the fiber, nutrients, phytonutrients, and antioxidants out of whatever you've taken it from. I tell people if you're going to eat something, eat the entire olive, don't eat olive oil. Eat the avocado, not the avocado oil. But still, I do not encourage the use of added oils. And this diet also does not include salt or sugar. Salt is the primary cause of hypertension in the United States, and we have a hypertension epidemic. Sugar, we're all addicted to sugar, and sugar is put in everything in order to make us like the food, and we eat way too much sugar. Sugar is inflammatory. Sugar causes our insulin to spike, and when our insulin spikes, we get more inflammation. So there have been decades of research that talk about the harmful effects of consuming animal products and processed foods. There are thousands of studies out there that show it. We know that meat causes cancer. We know that saturated fat and cholesterol cause atherosclerosis. These things are, it's not new information, it's decades worth of research. There are thousands of studies that have shown the benefits of consuming plant-based foods. And there's not a single study out there showing any deadly effects of consuming fruits, vegetables, whole grains, legumes, nuts, and seeds. I call meat the new tobacco. When the Surgeon General finally put a label on tobacco in 1964, there were over 7,000 definitive studies that showed that tobacco killed people. And we are at that point today. We have thousands of studies that show that the components of the standard American Western diet is killing people. So the number one killer of Americans is our diet. Okay, if you were ever curious. So we are a pill-popping nation. We have been programmed to go to the doctor and ask for a pill or a procedure to cure our problem. But this doesn't address the underlying cause of disease. The change must begin with the way we eat. This is an interesting cartoon, and we attribute this to Dr. Dean Ornish. It shows a couple of doctors here in white coats mopping up the floor. There's just, the water's the problem here, and they're mopping it up. And they've just been mopping the water up to try to solve the problem. But if you look behind them, you can see that there's a sink with the faucet running, and it's overflowing. And the concept here is that rather than mopping up the floor after the problem occurs, why don't you take care of the source and turn the water off at the sink? Similarly, we need to address our health concerns at the beginning on the front side with our diet and nutrition rather than treating our chronic diseases after the fact. These are some examples of whole plant-based foods: legumes, bulbs, flowers, fruits, stems, leaves, roots, whole grains, and nuts, and we include mushrooms because they're extremely healthy for you. I won't go into this in extreme detail because I'm trying to keep moving here. I've got a lot of pictures of what I consider very delicious foods. I've begun to appreciate the different colors and the tastes. I eat a much greater variety of foods today than I ever did before I became plant-based. This here is my favorite. I eat this a couple of times a week, a baked potato, and I top it usually with lentils. Buddha bowls, pizzas. Maya and I do pizzas all the time. So I want to talk a couple of minutes here and compare a whole food plant-based diet versus an animal-based diet. And specifically what I'm looking at here is nutrient composition in a 500 calorie meal. Interestingly enough, a 500 calorie plant-based meal has a larger volume. So you can eat more and become more satiated and satisfied. And I'll get into that in just a minute. But take a look at some things here. On the first line, a whole food plant-based meal has 0 cholesterol. Plant-based foods do not have cholesterol. Animal-based foods do. So there's 200 milligrams of cholesterol in an animal-based meal versus 0 in a plant-based meal. Look at the fat. We do need some fat, but a plant-based meal has a reasonable amount of fat. An animal-based meal has 36 grams of fat. The American diet is a high-fat diet, and that's one of the problems behind it. It leads to diabetes and it leads to atherosclerosis. Some people wonder about getting our protein. Well, then look at the next line. The same calorie meal has the same amount of protein. It might be a larger volume in the plant-based meal, but that's actually a good thing, again, for satiety. But you get the same amount of protein. And then there's a whole slew of other things you get. Now, and dietary fiber. Fiber is extremely important, and I'll address that in a second. There's a lot of fiber in a plant-based meal. Meat doesn't have fiber, and so you don't get any fiber. And then let's look at vitamin C, iron, calcium, beta-carotene, vitamin E, folate, magnesium, all of these vitamins and minerals. The plant-based meal is full of them, whereas the animal-based meal has barely a touch of them. You'd have to eat, I would say, 50, 60 pounds of animal-based foods on a daily basis just to get even close to what you can get out of a plant-based meal. So let's talk about the effects of cholesterol on your body. I mentioned how plant-based foods don't have cholesterol, animal-based foods do. And so cholesterol is one of the primary causes of atherosclerosis. It also has multiple deleterious effects on the body. We do need cholesterol. We need cholesterol for the formation of our cells, the integrity of our cells in our body, and we need cholesterol for hormones and for other functions. But our body makes all the cholesterol we need. Our liver makes cholesterol. Why would we have developed as a species making our own cholesterol if we needed cholesterol from an outside source? So we do not need cholesterol from an outside source. In fact, our body doesn't know how to process that cholesterol from an outside source. So if we eat exogenous cholesterol, it leads to deleterious effects. People like me, plant-based people, vegans, who don't get any cholesterol from the outside, we do not have hormonal issues and we do not have cell membrane issues. We make all the cholesterol we need. And then I told you I'd talk a little bit more about fiber. Americans are fiber deficient. The recommended daily amount of fiber that we're supposed to get, according to the USDA, is 25 grams a day. In reality, I would suggest we get 50, and the higher the better, 50 to 100. There are societies in Africa who get 50 to 100 grams of fiber a day, and they are heart attack proof. There is no, and as I told you, there's no fiber in animal products. 97% of Americans do not get that 25 grams of fiber a day. So we are a fiber deficient society. Fiber is found in every plant food. It helps to eliminate toxins. It binds to cholesterol and fats and helps you eliminate those without absorbing them. It helps with satiety. It makes you feel full. And importantly, it is a prebiotic. In other words, it's food for our healthy gut bacteria. By eating fiber, we provide food for our gut bacteria, and that allows us to grow a nice diversity of gut bacteria, which we live in symbiosis with and which help us have a healthier lifestyle. The standard American diet leads to a shift in our gut bacteria and leads to all sorts of problems, autoimmune disorders and absorptive disorders such as irritable bowel syndrome, ulcerative colitis, and things like that. So the key to a healthy gut is lots of fiber. So I want to talk just briefly here about calorie density. This red line in the middle of the slide is a separation between plant-based foods, which are on the left side, and mostly animal-based foods and processed foods, which are on the right side. You can see that plant-based foods are low in calorie density. What that means is you can eat a lot of plant-based foods and not get too many calories. But the beauty of it is, as I just pointed out, plant-based foods are highly nutritious, but calorie poor. So you can eat a lot and get good nutrition. Whereas animal-based foods and processed foods are high in calorie, but poorly nutritious. And so that I wanted to point that out. There's a couple of things I want to show you though. That in particular, nuts and seeds are on the right side, and they are healthy for you, but I want to point out how high in calorie they are, and that's why I tell people to limit the amount of nuts and seeds that you get. This is another way to look at caloric density. You can fill your stomach up with 400 calories of fruits and vegetables, whereas look on the far right, where 400 calories of oil hardly touches you. So if you eat some oily potato chips, you're just barely going to get a little bit of satiety, but you're going to get a lot of calories. Not to mention how poorly nutritious for you it is. And then in the middle are other cheese, animal products, and then again on the far side, beans, grains, and potatoes. 400 calories nearly fills you up. Again, the point here is that plant-based foods, whole food plant-based foods, are high in nutrition and low in caloric density. So I wanted to spend just a second talking about carbs. Carbs have been demonized in our society. This diet I'm talking to you about, a whole food plant-based diet, is a carbohydrate diet. It's the diet that we developed as a species on, and therefore I think it is the most healthy diet for us. And people have started to think of carbs as Coca-Cola, candy, sugary cereals, and donuts, and that's not true. Those are refined foods that have a lot of added sugar and even a lot of added fat. Real carbs are the stuff on the left side of this picture. Fruits and vegetables, green leafy vegetables, starchy vegetables, beans, lentils, peas, whole grains, corn. I encourage people to eat all that stuff on the left side for all the reasons I've all just mentioned. And they don't, and they're not bad for you. So I'm going to try to sum this up. Cardiovascular disease, there are 650,000 cardiac deaths per year. There's 140 stroke deaths per year. There's over 200,000 amputations per year. Right there is a million. As I told you earlier, there's at least a million deaths and severe illness caused by cardiovascular disease. That doesn't include the dementia, which I mentioned. It doesn't include the impotence, which I mentioned. And I haven't even touched on kidney failure. It's the #1 cause of death and disease in the United States. So after age 50, we are busy dying, not living, and we all have atherosclerosis to some extent. And the question I would pose to you is, now that you know this, what are you going to do? And I sum this up very simply by saying, you are what you eat. And that is an expression that we all know. Before I finish, I wanted to spend a couple of seconds talking about our current COVID crisis. There are some interesting similarities to what I've just talked about. I'm sure it's no secret now that most of you know that the people most susceptible to coronavirus or to dying from getting coronavirus infection are those with significant comorbidities. We talk about hypertension, obesity, diabetes, and cardiovascular disease, and then of course advanced age, and you can't do anything about that. But the other things I just talked about, those are the same things I just talked about with cardiovascular disease. And so you can make yourself healthier during this crisis by converting yourself to a whole food plant-based diet and make a positive impact in your hypertension, your diabetes, your obesity, and your atherosclerosis. I'd love to be able to take some questions on this if you guys have any of that. And then finally, before I wrap up, I'd like to thank Fit and Green Frisco for inviting me to talk. Maya and I have our own pod here in the Dallas area, and I wanted to share with you that I have a free guide that you can sign up for. If you go to our website, plantbaseddfw.com, you can sign up for the free guide and download it. But also here on the bottom right of the slide, it's bit.ly/Dr. Riz Guide. If you go to that website, bit.ly, Dr. Riz Guide, you can download the free guide. A couple of things that we've had to change the way we're doing things, and we no longer get to do our in-person events. We're trying to do things exactly like what Fit and Green is doing, and I'm so happy to see that. And we do a lot of online work. We have a podcast that I would encourage you guys to listen to. We have a YouTube channel. This month, on the 16th of February, I'm working with PCRM on an online class. It's a nutrition class, which they're specifically addressing issues related to health and nutrition and COVID. Right now, we're all participating, and I know Fit and Green is doing it too, in a Grand Canyon walk. It's a virtual walk, and it actually starts today. I don't know if you can still sign up for that, but if you can, I would really encourage you to. Again, thank you very much for allowing me. I'm going to stop the share.
Thank you. That was very informative, and sorry that we had only an hour. I know that there was a lot more we could talk about, but I think some of those will probably come through in questions. There are a few questions in the chat that we want to get through. There was a question posed earlier, so I'm just going to say that, and then we'll start with the questions we're seeing right now.
Okay.
The first question that came through that's not showing up on the chat is that, can there be a test taken to actually check for blockages? And what is your opinion and take on that?
Yeah, so we have, depending on our specialty, both heart and peripheral vascular that I do, we have what we call non-invasive studies or tests that we can do. There's some ultrasound studies and some things like that where we can, and also just our clinical exam, where we can judge the extent of a person's disease, also based on their symptoms. And then there's the most invasive, which is where I put a catheter in their arteries and I inject the dye. That's called an angiogram. So that's but that's an invasive test. It requires you going into a medical clinic or a hospital to get that done, and that's not without risks. So we don't do those studies unless we have a high suspicion that there is disease, because you have to weigh the risks and the benefits. So we start with the clinical evaluation by a physician, and then we go on to the non-invasive studies like ultrasound to help delineate it. So that's kind of how we work. Yeah, there are CAT scans that can be done, but typically insurance companies don't pay for that, and so if you want to do it out of your own pocket, you can. There are clinics like the Cooper Clinic and some other things like that where you can pay for a CAT scan out of your own pocket to have those studies done as well.
Okay, so just to summarize, there are invasive and non-invasive ways. Typically, it's recommended to go into it if you see enough cause to be able to check for it.
Yes.
Okay, got it.
We have one more question. I feel very gaseous when I have a bowl of legumes or lentils. How can I avoid that?
Yeah, so I think that's not an uncommon thing. I mean, many of us have experienced that. Even 4 and 5 years into this, I still sometimes get a little bit distended. I encourage people not to just go overnight and eat a lot of beans, legumes, and lentils, because we are not used to that amount of fiber. And I tell people to gently ease into a a high fiber diet. Going from being fiber deficient for the most of your life and then suddenly having a lot of fiber, there is some adjustment. And what happened, part of that adjustment is that the bacteria that I talked about in our gut, that has to change. And if we just do it overnight, well, we're eating a high fiber diet with a standard American gut. And what we need to do is allow our gut to change to a plant-based gut. And so I think that's one of the things. And then still from time to time, but I think that's really one of the main things I would recommend to people.
Dr. Riz, if I may add something here. As a nutritionist, I also recommend my clients to if you have soaked the legumes overnight, you want to discard the water you have soaked it in before cooking them. That also helps reduce some flatulence, and secondly, increase water intake.
Certainly, absolutely, I agree.
Thank you. The next question is, are cruciferous vegetables like cabbage and Brussels sprouts as good for nitric oxide as kale and spinach? I've been having a lot of spinach lately and want to mix it up since I try to get in leafy vegetables 3 times a day.
Yeah. So actually, the green leafy vegetables are really the ones for nitric oxide. If anything, outside of that, I would talk about beets. But beet greens have lots of nitric oxide, so do beets. The cruciferous vegetables are extremely healthy, and I encourage people to get that as a part of the variety of their diet. But those have other good properties, anti-cancer properties, for example, but not nitric oxide.
One more question, which is actually we have quite a few, but what is leaky heart, and can it be treated?
Honestly, I don't know what they're referring to, and I can't speak to that.
Okay, Mike's taken a moment to say great presentation. Thank you very much.
Thank you.
Then we have a question about, do you recommend probiotics?
So actually, no, I don't. Again, I'm very pragmatic. I go, well, as a species, we developed over the course of thousands of years, and we didn't take probiotics back then. We didn't need them. What I say is we get back to the basics of eating correctly. And when you change your diet and you the probiotic is the fiber. So if you eat a diversity of plant-based foods with various different types of fiber, that's the probiotics. That's the prebiotics for our probiotics. Now that's what feeds our probiotics and helps us obtain appropriate diversity of probiotics in our body. So and that recommendation, I try to be very scientific and evidence-based about my recommendations, and that's because right now there is no evidence that taking probiotics is beneficial in any way. It's more of a fad, just like the fish oil thing, than there being any hard scientific evidence that we know. And the thing is that we have trillions of gut bacteria, trillions of them, with millions of species. And how do we know in that probiotic which one to take and in what proportion and how that's going to affect us? So I think the reality is taking a probiotic is unproven.
Can I contribute to that answer right there, Dr. Riz? Monday's podcast episode that we're going to release is with Dr. Vanessa Mendez, who's a gastroenterologist and internist. And she basically answered a lot of our gut questions, including kombucha, which I see under the questions. And she's participating in a lot of summits right now. So it's going to be a very informative conversation.
Thank you, Maya.
Our next question is about what are your favorite sprouts?
My favorite sprouts. I don't eat sprouts as much as I eat microgreens. Can I talk about that? So my favorite microgreens are broccoli, and then the spicy microgreens like radish, and sunflower. And so I like to mix those together and the sunflower adds it actually does taste like sunflower. It has a nice nutty feel to it. And then I mix the radish in to give it a little spicy flavor. So I'm a real big microgreen person, and you can see that on my YouTube channel. I've got all these microgreen growing things and lessons on how to do it because I did them in my hydroponic garden. And then of course Maya and I have experimented with growing sprouts, and we'll continue to do so. But I'm a microgreen person. Yeah, again, microgreens are highly nutritious, and it fits in line with my whole eat green leafy vegetables.
We'll be sure to check that out. Any correlation to COVID severity and blood types?
So yeah, I've heard about this, and I won't pretend to be an expert on COVID. I mean, I treat COVID patients and I deal with it on a daily basis. And I've read about this, and there's some people who are throwing that out there, but there's not any real scientific data to show any hard evidence right now about that. We're seeing COVID severity and infections across all blood types right now, and we haven't seen a real pattern that tells anybody that you're this type blood type, so you're less susceptible to it. I wouldn't hang my hat on it right now. Okay, let's hang our hat on some other more scientifically proven things, like let's get healthy, let's reduce our hypertension, reduce our diabetes, lose weight, and become a overall healthier person, so that if you do get coronavirus, you don't get the severe symptoms of COVID. Don't go, okay, I'm B positive, okay, I can do whatever I want and not worry about it.
How do we replace calcium and B12 intake in a plant-based diet?
Okay, so calcium is present in a plant-based diet in adequate quantities. And again, when I talk about a whole food plant-based diet, I don't recommend people just eat one thing over and over again. I recommend a variety of things. Eat several green leafy vegetables, several fruits, different types of legumes, lots of different types of grains. And when you do that, you're going to get plenty of calcium in your diet. So people on a good plant-based diet are not in any way calcium deficient. And in fact, the calcium the fortified calcium and all the calcium that we get in the Western diet has been proven not to help with osteoporosis and decreased bone fractures. We have some of the worst osteoporosis and hip fracture rates in the world, here in the United States. So we're certainly not doing something right there. And so but you're not calcium deficient on a plant-based diet. Now, B12 is a very good question. I do recommend that vegans and plant-based eaters do supplement their diet with B12, and that's really not because of a problem with our diet, but it's a consequence of the good hygiene of our current society. If you go back a few hundred years, people so the B12 that people get in the standard American diet comes from bacteria. It doesn't come from the meat. Okay, bacteria make B12, but unfortunately our water supply and our foods are so clean now, the bacteria that made the B12 is no longer in our foods. I mean, it's unfortunate, but it's fortunate, so we have very clean food, so we're not getting other issues as well. So I do recommend a B12 supplement. You can either take it daily or you can take it once weekly, depending on which particular one you take.
All right, thank you. We have a few more thank you notes coming in. Another question is, are smoothies okay every day, or is it actually eating the veggies the best?
That's a really good question. And I'm drinking my green smoothie right now, which, by the way, the recipe's in that guide if you download it. The honest answer is the best way is to eat it. Okay, and but I'm a realist, I'm a pragmatist, and I'm like, okay, do what you need to do to get that all in. And so I think smoothies are a great opportunity to get a high volume of fruits and vegetables and other things in you without in a very convenient manner. And so it may not be 100% as healthy as, say, eating the actual true thing, because I think there is some benefit to chewing it and eating it. But at the same time, if it's something that you wouldn't have eaten, and now you're going to at least drink the smoothie, which gets you 95% of the value, then I recommend it. And that's what I do. Because of my lifestyle, I think smoothies are a regular part of my lifestyle.
Makes sense. Thank you. Can you talk a little bit about the correlation between eating too much spinach and kidney stones?
There's something called oxalate stones. And spinach has a lot of oxalates in them. There are a couple of other green leafy vegetables that have oxalates as well. And so for people who are prone to kidney stones, I don't recommend taking in a lot of spinach. Now that's that may be something that's overdone or people are oversensitive to. There might be people who are perfectly normal who are avoiding spinach for no good reason. The incidence of kidney stones in people who eat a lot of spinach is still extremely low. Okay, it's not like, okay, for every 100 people who eat a lot of spinach, 10 of them are going to get kidney stones. Probably 0 out of 100 are going to get kidney stones. It's when you're talking about in the thousands, someone's going to get a kidney stone. And but so for me, I tell people, okay, if there is an issue with you having had kidney stones in the past, you might want to limit the amount of spinach you eat. But that's okay because there are dozens of other green leafy vegetables you can eat.
Okay, I'm going to combine the next two questions. Can you speak a little bit about the complications you're now seeing in COVID patients, blood clots, etc.? And are you recommending the vaccine?
Two great questions. And I'm going to tell you, I am absolutely overwhelmed by the blood clot issue. I mean, I'm the person they call. And in my entire career, I have never been called for so many blood clots in my life as I have been during this COVID crisis. And people are losing their limbs left and right. And they're dying. And what's happening is they're forming blood clots in their veins that then embolize to their lungs and cause a pulmonary embolism. And then they can't breathe and they die. And then they're also forming blood clots in their arteries where they lose the blood flow to their arteries. I have a patient in the hospital right now. He's so sick that I can't even operate to take his leg off. So I put his leg in dry ice. I'm mummifying his leg right now in order and hoping that they can get him better so that I can go and take his leg off. So these are really tragic times. I know that you people out there as the layperson don't see it, but for me this has been just a crazy year. These embolisms, so yeah, there's something, and we do not understand the process because it's so new. And we don't know why they're forming the blood clots, but they are. And when they do, it's pretty devastating. I was just speaking with a colleague of mine who runs several nursing homes, and he's putting all of his patients on blood thinners, all of them, and yet they're still forming blood clots when they get COVID. Yeah, and we're not talking about minor blood thinners, we're talking about full-blown blood thinners. This reminds me of that Broadway actor who had the Tony Awards, who we saw a lot on Instagram. His wife was posting a lot of his what was going on. This was in the spring, and he eventually lost his legs, and then he eventually died. And that for me, that was at the early part of the crisis, and I didn't understand it because I hadn't seen a lot yet. But now that the crisis hit Dallas really hard in the last few months, and we were being hit in Dallas just the same way they were being hit in New York early on, we were starting to see all the same stuff that they were seeing. So that's it about blood clots. As far as the vaccine is concerned, I know that there's a lot of controversy around it, and it's unfortunate. In my opinion, the vaccine is something that you should really strongly consider. I have had the vaccine. I'm able to understand the vaccine at a highly scientific level, and I know what it does, and I understand that it's safe, and that there's no ill consequences of it. But I know for the layperson, there's so much information out there. There's so much disinformation and just opinion that's circulating. My receptionist in my own office didn't want to have the vaccine because she heard it makes women infertile. And, she heard that on YouTube. And so it's, but of course, there is no evidence to that effect. I will tell you that they tested the vaccines on tens of thousands of people. And these were much higher numbers than they normally test a vaccine on. And people are scared about how quickly this vaccine was developed, but the reality is the basis for the development of this vaccine goes back 10 years. Because they were developed, the mRNA vaccine for the Pfizer and the Moderna was being developed for the Ebola vaccine. And so the concept, it was already there, and then they just took that concept and developed a vaccine for the coronavirus. And then they tested it on more people than vaccines are generally tested on, and it was found to be very, very safe. And I can tell you right now, we've vaccinated over 20 million people with very, very few ill effects. And we know that there was one death in a doctor, but it turned out that he had an underlying issue, and the death was probably not vaccine related. And so if you can vaccinate 20 million people and not have any ill effects, I think that's a good demonstration that it's a safe thing. I would encourage people to really educate yourself with real information not hearsay, not some guy speaking his opinion on YouTube. Real evidence, real hard evidence, and then to make the decision. If we ever want to come out of this crisis and have some sense of normalcy, a significant number of people need to get vaccinated in order for that to happen.
Thank you. We want to be mindful of your time and everybody else's. I know we've already gone over, but I do see 2 more questions. I'm going to throw that out there.
I'll stay as long as you want.
Oh, that is so kind of you. We really, really know how hard these times have been on you, Dr. Riz. So thank you so much. So I'm going to ask a couple, again, I'm going to combine 2 questions. One was, what is a healthy serving of nuts and seeds? And the other was, is ghee, which is clarified butter, nutritional, or is it just fat like other oils?
Okay. So for nuts and seeds, I recommend 1 to 2 ounces daily. There's a lot of studies out there, and you can have a variety, by the way. There are some studies out there that show that people who take in 1 to 2 ounces of nuts and seeds a day increase their lifespan by 2 to 3 years, and so that's a very interesting thing. It may not be purely indicative of just the nuts and seeds, because how can you separate that out when you're doing a retrospective study? But it might be indicative of the lifestyles of people who eat 1 to 2 ounces a day. And so 1 to 2 ounces is what most of us in the plant-based world recommend. And that's a healthy amount of nuts and seeds and the fat that comes from them. What was the second question?
Is ghee, which is clarified butter, is that nutritional, or is it just like any other fat?
So yeah, the simple answer is there's nothing healthy about ghee. And so yeah, it is just another fat. In fact, it's probably concentrated fat. So no, I don't recommend ghee as a part of our diets.
Okay. Thank you so much. Last question. What about people getting Bell's palsy? This is back around the vaccination when we were talking about it. What about the connection between Bell's palsy and the vaccinations?
Yeah, so they've talked about that and they've looked at it, and they don't see any significant increased incidence so far. People get Bell's palsy all the time, and you don't know what the cause is. So there hasn't been anything that's shown a cause and effect as far as that's concerned. I would say too that even if that was a side effect, the Bell's palsy is usually a self-limited process and is usually gone within a few months. So it's not a permanent thing.
Thank you so much. Again, thank you for staying later than scheduled. Going to hand it over to Meeta to say a few words of sincere gratitude to everybody.
Thank you, everyone, for joining us, and especially Dr. Riz and Maya for making this a possibility today. I know this is such a hard time for you, Dr. Riz, especially most of us get to work from home and do not really see what's happening on the front lines. And to you and all the first responders, we are so thankful for all that you're doing right now. At the same time, Dr. Riz, you divide your time between taking care of people and helping them with their medical needs, but at the same time, this part of your work and Maya's efforts in educating us and preventing getting there in first place is a huge contribution on your hands. So we really appreciate that from you.
Well, thank you. I would want to make one comment. That's one thing that's especially frustrating for me is that the COVID crisis has consumed our hospitals. And so not only are we losing people to this disease where we could have had a stronger impact if we had been better in the way we handled it, but also it's limiting healthcare to other people. I have patients with aneurysms, with carotid blockages, with gangrene, who I cannot get into the hospital to fix them. And the guy with the gangrene, if we can't fix him in time, is going to lose his leg. People with carotid blockages, they might have a stroke waiting for the operation, and people with aneurysms might rupture and die. And so there's a downstream effect of our hospitals being full with the COVID patients, is that regular patients are not having access to care that they used to have. So it's affecting everybody.
Yeah, absolutely. So again, thank you everybody. Thank you, Dr. Riz. again, we keep talking about the fact that you joke that you're trying to put yourself out of business by telling us what you're telling us. So we appreciate that. We're there. And, again, thank you for both you and Maya for all the educative work that you're doing. We will post this recording on both groups. I'm guessing, Maya, the recording will be available on the plant-based DFW group as well. If possible, if there are any other questions, again, please let us know. And I think if the slide, a few people reached out to me and said that somewhere along the way they couldn't see the slideshow and some of the items in there. So outside of the video, we'll try and also post the slideshow if that's okay, Dr. Riz. And again, thank you very, very much. We know that these few days, these times have been particularly more difficult. So for you to take the time to share this time with us, we're really, truly grateful.
Thank you very much. Take care.
Thank you, everybody.